Today, we are going to talk in detail about a very commonly used supplement in the medical world called Neurobion, which contains 3 essential vitamins known as vitamin B1, vitamin B6, and vitamin B12. If you have ever visited a doctor for nerve pain, burning sensation in feet, tingling in hands, general weakness, or even unexplained fatigue, there is a high chance you may have been prescribed this medicine. But the important question is, what exactly is Neurobion? How does it work inside your body? And why are these 3 vitamins so important for your nerves and overall health? To understand Neurobion properly, we first need to understand the concept of B-complex vitamins. The B-complex is not a single vitamin, but a group of water-soluble vitamins that play a crucial role in energy production, nerve function, brain health, and blood formation. The main characteristic of these vitamins is that they are water-soluble, meaning they dissolve in water and are not stored in large amounts in the body. Because of this, they need to be regularly supplied through diet or supplements. When their levels drop, the body starts showing deficiency symptoms, especially related to the nervous system and energy levels. Neurobion is basically a combination of 3 important members of this B-complex family: thiamine, vitamin B1, pyridoxine, vitamin B6, and cyanocobalamin, vitamin B12. These 3 vitamins work together like a coordinated system that supports nerve repair, improves energy metabolism, and maintains proper communication between the brain and the body. Let's start with vitamin B1, thiamine. This vitamin plays a fundamental role in converting the food we eat into usable energy. Specifically, it helps in carbohydrate metabolism, meaning it helps your body turn glucose into energy. Every cell in your body needs energy to function, but your nervous system is especially dependent on a constant energy supply. Without enough vitamin B1, nerve cells become weak and inefficient. This can lead to symptoms such as fatigue, irritability, poor concentration, and in more severe cases, nerve-related symptoms like tingling or burning sensations in the limbs. Another important role of vitamin B1 is supporting nerve signal transmission. It contributes to the proper functioning of peripheral nerves by helping maintain the integrity of myelin, which is the protective covering around nerves. When myelin is weak or damaged, nerve signals become slow or distorted, leading to abnormal sensations like numbness or pins and needles. Now moving on to vitamin B6, which is equally important but works in a slightly different way. Vitamin B6 is essential for brain function, immune system support, and the production of neurotransmitters. Neurotransmitters are chemical messengers that allow communication between nerve cells in the brain and throughout the nervous system. One of the most important neurotransmitters influenced by vitamin B6 is serotonin, which is responsible for regulating mood, sleep, and emotional balance. When vitamin B6 levels are low, serotonin production can be affected, leading to symptoms such as irritability, mood swings, anxiety-like feelings, or even depression-like states. In addition to brain function, vitamin B6 is also crucial for the production of hemoglobin, which is the protein in red blood cells responsible for carrying oxygen throughout the body. This means that deficiency of vitamin B6 can also contribute to symptoms of anemia such as fatigue, dizziness, and weakness. Another very important role of vitamin B6 is the regulation of homocysteine levels. Homocysteine is an amino acid that, when present in high amounts, can damage blood vessels and increase the risk of cardiovascular diseases. Vitamin B6 helps convert homocysteine into safer substances, thereby protecting the heart and blood vessels. Now let's discuss vitamin B12, which is one of the most critical vitamins for nerve health and blood formation. Vitamin B12 plays a central role in the maintenance and formation of myelin, the protective sheath that surrounds nerves. Think of myelin like insulation around an electric wire. It ensures that nerve signals travel quickly and efficiently. When vitamin B12 is deficient, this protective sheath starts breaking down, leading to slow or faulty nerve transmission. This is why vitamin B12 deficiency is strongly associated with peripheral neuropathy, a condition that causes tingling, numbness, burning pain or loss of sensation, especially in the hands and feet. In more advanced cases, it can also affect balance and coordination. Vitamin B12 is also essential for red blood cell production. When levels are low, the body produces abnormally large and immature red blood cells that cannot carry oxygen effectively. This leads to a type of anemia called megaloblastic anemia, which causes symptoms like weakness, fatigue, shortness of breath, pale skin, and sometimes dizziness. Apart from this, vitamin B12 is also very important for brain function and mental health. Low levels have been associated with memory problems, confusion, mood disturbances, and in older adults, even cognitive decline if left untreated for a long time. When these three vitamins B1, B6, and B12 are combined in Neurobion, they create a powerful supportive effect for the nervous system. They do not work as painkillers that give instant relief, but instead work gradually by improving nerve health, repairing damage, and correcting deficiencies. This is why Neurobion is often prescribed in conditions like peripheral neuropathy, diabetic neuropathy, neuritis, polyneuritis, and general vitamin B deficiency states. One of the most common conditions where Neurobion is used is diabetic neuropathy. In diabetes, long-term high blood sugar levels damage small blood vessels and nerves, especially in the extremities like hands and feet. Patients often describe this condition as burning pain, electric shock-like sensations, tingling, or numbness that can become worse at night. While controlling blood sugar is the most important step in managing this condition, B-complex vitamins, like those in Neurobion, are often used as supportive therapy to help improve nerve function and reduce symptoms over time. Neurobion is also helpful in individuals with poor dietary intake, especially those who do not consume enough animal-based foods. This is because vitamin B12 is mainly found in foods like meat, fish, eggs, and dairy products. Vegetarians or individuals with limited dietary variety may therefore develop vitamin B12 deficiency over time. Similarly, older adults are also at higher risk because the body's ability to absorb vitamin B12 decreases with age. Another group at risk includes individuals with chronic alcohol consumption. Alcohol interferes with the absorption and utilization of B vitamins, leading to deficiencies that can result in nerve damage, weakness, and cognitive issues over time. In such cases, supplementation with B-complex vitamins may be recommended under medical supervision. However, it is very important to understand that Neurobion is not a quick pain relief medication. It does not work like a painkiller or anti-inflammatory drug. Instead, it works slowly by supporting nerve repair and improving vitamin levels in the body. This means that noticeable improvement may take several days or even weeks, depending on the severity of the deficiency and the underlying condition. Patients should therefore have realistic expectations when using this supplement. Like all medications and supplements, Neurobion should also be used carefully. People who are allergic to any of its components should avoid it completely. In some cases, excessive long-term use of high doses of vitamin B6 may lead to nerve-related side effects, so it should always be taken under proper medical advice. It is also important not to self-diagnose vitamin deficiencies because many symptoms like fatigue, tingling, or weakness can be caused by multiple different health conditions. To conclude, Neurobion is a combination of three essential vitamins B1, B6, and B12 that play a vital role in maintaining nerve health, supporting energy production, improving brain function, and assisting in red blood cell formation. It is widely used in conditions involving nerve damage, vitamin deficiencies, and metabolic imbalance. While it is generally safe and beneficial when used correctly, it should always be taken responsibly and preferably under medical supervision. If we summarize everything in simple terms, Neurobion is not a magic cure, but rather a supportive therapy that helps the body repair and maintain one of its most important systems, the nervous system. And understanding how it works allows patients to use it more effectively and safely.